Good morning, Mrs. Smith. Why are you here today? What's wrong?
Well, actually, I haven't been feeling well these days, doctor. I feel sick.
I see. All right, then. You can tell me what's wrong.
Well, I don't know exactly what's wrong with me, but I've had fever for 5 days.
5 days of fever doesn't sound good. How did it start the first day?
I was working normally the last Monday and then I got a little dizzy while I was at the office.
It was on Monday. Okay. What did you do the day before Monday? On Sunday.
I was at home all day. Well, at night, I went to a party. It was my cousin's birthday.
And what did you eat during this party? Anything that could hurt you.
Well, they prepared a special food for that day. I think it was Thai food.
Have you had Thai food before or it was the first time you ate that?
I have eaten Thai food a lot of times before and nothing happened. I like it.
All right. Anyway, we need to check all the possible options here, you know.
Sure, doctor. But I don't think the food made me sick. I didn't feel bad.
We'll see. Did you have a stomachache that day or the next day?
That day at night, nothing happened. But the next day I woke up with a stomachache.
On a scale of 1 to 10, being 1 not any pain and 10 a lot of pain, how much did it hurt?
I suppose it was a 2 in the morning when I woke up, but it was 7 in the afternoon.
Okay. I also need to know. Did you drink any beer or any kind of alcohol at the party?
I don't drink alcohol, doctor. I haven't drunk it since I was diagnosed with fatty liver.
Oh, you have a fatty liver. When exactly were you diagnosed with that condition?
It was 2 years ago. I went to the hospital because of a pain on my stomach.
I get it. It's important to know that. Any other illness we need to know?
Well, last year I broke my leg while I was driving my car. I had an accident.
Wow. That's terrible, Mrs. Smith. I'm really sorry about that.
Thank you, doctor. But that's okay. It was not very serious. Happily.
I can see. That's why you're walking normally. I supposed it wasn't.
Yes. I had to use a cast on my leg, but just for 3 months. That was terrible.
I suppose so. Well, going back to last Sunday. Did anything else happen?
No, doctor. I think that's all. I arrived home late that day and fall asleep.
All right. What prescription and non-prescription medications do you take?
Well, I don't usually take any pills. Just some painkillers when I have any pain.
I need to know exactly what kind of painkillers do you take. It's important.
I don't remember the name of it very well, but I think it is no pain more pills.
Okay. What allergies do you have? Are you allergic to anything?
I don't think so. I have never had any problems with any food or drinks.
All right, but are you allergic to any medication? Any pills?
No, doctor. I'm not allergic to any pills or medication. I can take them all.
Great. Have you had any operation before for any reason?
No. I've never been operated for any reason. Happily. That must be horrible.
It can be, sometimes. What do you do for a living, Mrs. Smith?
I am a manager in the biggest restaurant of the city. Maybe you know that.
You mean the Tast restaurant that is in the center of the city? The Chinese one?
Yes. That one. I work there from Monday to Friday from 7 a.m. to 6 p.m.
I see. And do you eat there or you take food from your home to work?
I usually cook at home and take it to my work, but sometimes I have to eat in the restaurant.
Have you eaten the food from the restaurant these days? Before you got sick?
No. The last time I ate there was 3 weeks ago and it was a salad. Nothing fatty.
I see. Do you smoke, Mrs. Smith? If so, how often do you do it?
I don't smoke very often. Probably once or twice a month and that's it.
Do you feel pain in your throat? I mean, do you have a sore throat?
Yes. I feel a little pain on my throat. But it always happens to me.
What do you mean it always happens to you? Do you usually feel pain on the throat?
Well, I've suffered from this since I was a child or since I can remember.
I see. I can see you're sneezing, Mrs. Smith. Why is that?
It usually happens when I feel pain on my throat. I sneeze and cough a little.
Since when are you sneezing and coughing? Did it start the same day?
Yeah. To be honest. I always sneeze and cough, but just a little. It's not a big deal.
I know it doesn't seem serious, but we need to check all the options as I already told you.
Okay, doctor. But I thought it was normal since I've had this problem for years.
Well, we'll need to do some exams to see if that is the problem or there's something else.
Okay, doctor. But do you think it can be serious? I need to come back to work.
I don't recommend you to do that. You'd better go home and rest a little for today.
What? Wow. Is it that serious, then? I mean, I've been working like this.
Look, I'm not sure, but I'm afraid you could have pharyngitis. I suspect so.
Pharyngitis? What is that? I've never heard about that before.
It is inflammation of the pharynx, which is in the back of the throat. Do you understand?
Yeah, I can understand the problem of the throat, but what about the stomachache?
Well, sometimes it happens that an infection can affect other parts of the body.
Oh, God. I hope it isn't anything serious. I can't stop working.
In the worst case, we will need to operate, but it is not dangerous. Don't worry.
Okay, doctor. Then, what do I need to do now in order to get better soon?
I will give you an order to do this exam and then we'll see the results next week.
Thank you, doctor. I will wait then until the results are ready to know.
Yes. Go pass with my assistant, please. And that's it for today.
Good morning, I am Dr. Emma. How can I help you today?
Good morning, doctor. I'm Mrs. White and I'm here because my daughter has diarrhea.
Oh, poor baby. It must be very hard for you too.
Yes, doctor.
I'm sorry to hear that, Mrs. White. May I have her name, please?
Her name is Mary.
What a nice name. And how old is she?
She's 9 months old.
She's still very young.
Yes, very young to suffer this illness.
Right? Can you tell me more about her condition?
Her stools were watery for 3 days now and defecates 3 to 4 times in a day. She very lethargic and does not eat well.
I see. Can you describe the stool? What's the color?
It's yellowish.
Is there blood on the stool? If so, is it fresh blood?
The stool has blood, but I don't know what a fresh blood looks like.
Okay. Any mucus?
No, doctor.
Have you taken her temperature?
Yes, but her temperature is just 36.5. That's normal, right?
Yes, her temperature is within the normal range. Was there a time that she was shaking?
No.
Where is she now? Is she staying with you?
Yes, she's with me.
Have you tried giving her medications?
No, I don't know what medication to give her.
Okay. Have you noticed any food that makes her diarrhea worse?
Few minutes after breastfeeding, she tends to defecate a lot.
I see. Any other symptoms that you have noticed?
No, doctor.
How often do you have to change her diapers?
Around 10 in a day.
Has she ever had any similar episodes before?
No, doctor.
Is she a full-term baby?
Yes, doctor.
Was she delivered vaginally or C-section?
Vaginally.
Did you have routine checkups during your pregnancy?
Yes, doctor.
Did you have medical problems during pregnancy or after birth?
No complications at all.
Are her immunizations up to date?
Yes.
Does she have regular checkup with her pediatrician?
Yes, doctor.
Who usually takes care of her?
My mother and I.
Can you tell me about her diet recently?
She's exclusively breastfed.
Has she ever traveled?
Not yet.
Mrs. White, I think your daughter has an infection in her bowels. For adults, it might not be a serious problem, but a baby as young as her has to be closely monitored. A baby's immune system is not fully developed yet, so they are prone to infection. We need to confine her to this hospital for close monitoring and for hydration. However, there may be other causes of the symptoms that she is manifesting right now. For us to rule out other possibilities and get the exact diagnosis, we need to do some tests.
What brought you here, Ellen?
I'm so sorry.
How long have you been coughing?
It's been 3 months already.
So it got worse recently.
Yes, doctor.
Do you notice some phlegm?
No,
Is the cough there all the time? Or it's on and off?
it's been here all the time.
Is there anything that makes your cough worse? Like positional changes, seasonal changes, after eating?
Positional changes like lying down makes me cough even worse.
Is there anything that makes your cough better? Have you taken any medication?
I took some cough medication.
So do you have any other symptoms besides a cough? Any fever? Chills? Night sweats?
I have had on and off fever.
Have you noticed any changes in your weight? Any changes in your appetite? Any changes in your bowel habits?
I have lost weight, though my appetite seemed normal and my bowel habits are regular.
Have you experienced shortness of breath? Have you felt any chest pain?
Yes, there were times when felt like I was catching my breath, and I also experienced chest pain sometimes.
Have you ever had wheezing? Headaches? Runny nose? Sore throat? Postnasal drip?
Yes, I have had postnasal drip.
Have you ever had asthma? Gastric acid problems? Allergic rhinitis? Drug allergies? Any heart problems?
No, I have not had any of those.
Do you have any other problems in your lungs? Stomach? Liver? Kidneys?
No, doctor.
Have you ever had any surgeries?
I never had one in my life.
Is there anybody in your family being sick now? What about at work?
Actually, I work at the daycare center and the kids are always sick.
Do they have the same cough as you do? A cough without phlegm?
Some kids cough with phlegm, but some also have none.
Is there anybody who has had tuberculosis around you?
No, doctor.
Is there anybody in your family having other disease such as diabetes? Heart problems? High blood pressure?
My father has high blood pressure.
Now I would like to ask some personal questions which can be helpful for me to figure this out better. Is it okay with you?
No problem, doctor.
So how long have you worked in the daycare center?
About a year, doctor.
Do you drink? Do you smoke? Do you use any illegal drugs?
I drink occasionally, but I have not tried smoking and using illegal drugs.
Now, I would like to ask you about your sexual life. I know this is very private, but sometimes this can give us a big hint. Will you not mind?
Not at all. I am open for those questions as long as it can help figure out my problem.
Okay, are you sexually active? If so, how many partners do you have? Do you use protections?
No, doctor, I'm not sexually active.
Where are you originally from?
I'm from the Philippines.
Have you recently traveled? When is the last time you traveled outside of Los Angeles?
I went home to the Philippines 3 to 4 months ago.
Do you have any pets at home? Were you exposed to any animals or birds recently?
No.
Have you ever had PPD test? Like an injection on your arm and measure the round-in duration 2 days later?
Not yet, doctor.
Okay, thank you for answering my questions, Miss Ellen. Even though there are some more possible sources of your coughs, like asthma or pneumonia, I'm still not sure exactly what it is. So I will run some tests such as blood works and chest x-rays. I think I can talk to you better about the diagnosis and the proper treatment when I get the result of those tests. In the meantime, I will give your medication to ease your cough. Do you have any questions?
I work at a day care center. Is this the reason why I have a cough?
It might.
Do I need antibiotics to get better?
Maybe. It depends on what you really have though. If it is pneumonia, they help. But for others, they do not.
Okay, doctor. Thank you so much for your time.
Welcome. See you soon.
Hello, I'm Dr. Jack. I'm the doctor on duty for today. How may I help you?
Hello, doctor. I'm Mr. James. I'm having stomach pain.
Can you spot exactly where the pain is?
I think it hurts all over.
All right. On a scale of 1 to 10, with 10 being the worst pain, which number would you rate the pain?
It's somewhere 4 to 6.
Please describe to me how it hurts.
It's a diffuse, irregular abdominal pain, doctor.
How often does it come, and when it comes, how long does it last?
It comes twice or thrice a month and it lasts about 10 minutes maximum.
How would you describe the pain? Is it dull, sharp, or shooting?
Shooting, I guess.
Do you remember when it started? Have you experienced this kind of pain before?
No, I have not. It just happened all of a sudden. It started maybe about 6 months ago.
Can you remember any event that might have triggered it?
No, I can't remember anything.
Is the pain getting worse, better, or unchanged?
It's getting worse lately, and I have noticed that it typically happens early in the morning.
Is anything making it worse?
Yeah, when I eat, so I take Malox to feel better. I feel better also after emptying bowels.
Aside from Malox, are you taking other prescribed medicines?
No, just Malox.
Are you feeling something else aside from your abdominal pain?
I have occasional constipation. I'm having dark stools lately but no blood present.
Have you passed gas?
Yes, I did.
Have you noticed any changes in your urinary habits?
No, I have not.
How would you describe your appetite these days?
My appetite's fair enough, I think. I like eating fast foods.
Do you have known allergies?
None, that I know of.
Have you been hospitalized before? Undergone some surgery, perhaps?
No, doctor. I have not been hospitalized ever.
Okay, I think I have not missed out on anything. This time, I would like to do some examinations on you. Any questions so far?
No question as of the moment. You may begin the examination, doctor.
First, I shall take a quick look on your eyes. Please open your mouth. Next, I shall check if you have swollen glands around your neck. All right. Now I am going to examine your belly. Would you please lie down? I'm going to listen to your belly first. Just be comfortable. Now, I am going to press on your belly. When you feel some pain, please let me know.
Okay, doctor.
Thank you for your cooperation, Mr. James. So far, I'm suspecting irritable bowel disease. It means that your bowel is sensitive or your stomach problem might be due to some irritation in your stomach itself or your bowel. To rule out the exact cause, I'd like to run some tests on you, including endoscopy.
What is that, doctor?
We will be looking inside your body, particularly the digestive area. We will be using an endoscope. It is an instrument used to examine the interior of a hollow organ or cavity of the body. I will be able to tell you the exact reason and give you the proper treatment of your condition once I have the results. In the meantime, I'm giving you some medication to ease your stomach problem. Do you have questions?
Okay, doctor. I shall have the tests. I hope you will find out soon the exact cause of my condition. Thank you.
Good morning, Mrs. Drew. You look sad today. Is there something wrong?
I tried to take several Tylenol tablets to kill myself yesterday. My husband sent me here. People think I'm crazy.
Can you tell me more about it?
I have been depressed, doctor.
When did you start feeling depressed?
About 3 days ago, doctor.
Did something happen? Was there anything that made you sad?
None. Well, I gave birth to a baby boy 3 weeks ago. I think I'm a terrible mother.
What made you say that?
It's just that I am not a good mother.
I'm sorry to hear that, Ms. Drew. But hey, you are not the only mother who feels that way. There are mothers out there who go through this kind of depression after giving birth. This might sound weird, but it's true. It's very hard to be a mom. And you know what? I'm here to help you.
Okay, doctor.
Now, have you ever had similar episodes before?
You mean feeling depressed after giving birth?
Yes.
No. He is my first baby.
Okay. Were there complications during pregnancy and after delivery?
There was none, doctor. I had a normal delivery and the baby is in good health.
Good to hear that. Mrs. Drew, do you think this depression is affecting your life now?
Yes, a lot.
I see. Any weight loss? Appetite loss?
Yes. I lost some weight and I don't like to eat.
How about sleeping problems?
Yes. I can't make myself sleep sometimes.
Do you feel sad? Worthless? Hopeless?
Yes.
Aha. Mrs. Drew, I shall ask you a sensitive question. This would help me learn more about how you feel. Do you mind?
Not at all. It's okay, doctor.
Thank you. Now, have you ever thought of killing the baby?
I have, but I never tried.
Do you feel ashamed of what you were thinking?
Yes, I do. It makes me feel I'm the worst mother in the world.
Okay. Have you ever been depressed before? Did you receive treatment?
Actually, when I was in college, I was diagnosed with depression. My dad passed away and I felt really sad.
I'm sorry. But I'm glad you were able to overcome that situation. How is your husband? Is he supportive?
He is doctor. He always tries to understand me.
That's good. Are there any family members you are close with? Or friends you can talk to if you have problems?
Don't worry, doctor. I have a lot of friends to turn to.
Great. Do you know of anybody in your family who was also diagnosed with depression?
Yes, my aunt. She was depressed when her husband died.
I see. Thank you for answering all my questions, Mrs. Drew. I understand this situation you are going through right now is tough. Once you feel depressed, it is hard to get out of it. You need help. You might hurt yourself again. So it seems like the best idea is for you to stay in the hospital for a couple of days so that I can fully examine you. And I also recommend you get some counseling. That will help you a lot. In the meantime, I shall give you some medications which can make you feel better. How does this sound to you?
Sounds good, doctor. Thank you.
You are welcome.
Hi, doctor. I'm sick.
Okay, what seems to be the problem?
My fever is really high.
It's probably because of a virus. Do you have a cough?
Yes, I do.
That's nothing unusual. Viruses cause a lot of colds and few symptoms. We all need to practice good hygiene to help prevent them.
I know, but it's really bad.
Okay, what's your temperature?
It's 102 degrees.
That's a bit high, but not really surprising. Your body is working overtime to fight off a viral infection.
I know. It's just so uncomfortable.
I can give you some medicine to make you feel better.
That's not necessary. I just need to get through the day without feeling miserable.
I understand, but you are probably going to feel better soon. You'll get your energy back in no time.
I hope so.
I'm sure you will. I'm going to give you some medicine to make you feel a little better.
Thank you.
What brings you in today?
I have a fever.
Okay, that's a pretty common complaint. Tell me, how long have you had this fever?
I don't know exactly. I think it started yesterday.
Okay, have you taken any medications to try to bring it down?
No, I have not.
Well, I would like to give you something to help you feel better. But I am concerned that you might experience side effects if I do.
I understand.
So, let's talk about this a little bit. I would like to make sure that you are comfortable with my recommendations.
That sounds good.
I think I should mention first that there is a very good chance that you are suffering from a virus. And if you have a fever, it's likely that you have caught a cold or flu. I don't think you have had a fever this high before, so I'd like to rule out infection first.
I understand.
Let's talk about your options. I'm going to give you a prescription for some over-the-counter medication. It's called acetaminophen. It's very effective at bringing fevers down. I think it's safe to take for at least 3 days.
I'm sure I can take it for 3 days.
You might have some minor side effects from taking it, but it's a small price to pay to feel better.
Okay, sounds good.
Okay. I'm going to write you a prescription for a couple of days' worth of medicine. It's just to make sure that you get well.
I understand.
I'm going to have you come back in 1 week to make sure you are feeling better. If you are still sick, then I will give you a different prescription.
That sounds good.
I will see you next week.
Thank you, doctor.
Hello, Mr. Jones. How can I help you? I have been having a headache for a few days now. Are you sure it is not just a normal headache? Yes, I'm pretty sure. Well, let me take a look. Okay. Your forehead looks a little red. Do you have any allergies? I don't think so. What about sinus problems? I don't think so. Have you been sleeping well? Yeah, I have been getting about 6 hours of sleep every night. That's not an insufficient amount. Yeah, I know. Have you been feeling tired all day? Yeah, a little. How about your appetite? I'm not really hungry, but I'm not losing weight. I'm not really hungry, but I'm not losing weight. Have you been drinking enough water? Yeah, I try to drink a couple of glasses every day. That's a good idea. Yeah, I know. Let's take a look at your head. Okay. It seems like your forehead is a little swollen. Yeah, it's a bit tender. Do you have any problems with your vision? No, my eyesight is fine. Do you have any pain in your joints? I don't think so. Have you been feeling any other symptoms? No, I don't think so. I'm going to give you a prescription for some pain medication. Okay. I would like to see you again next week. Okay. Thank you, doctor.
Good afternoon. You look so out of breath. Are you okay?
No, doctor, I'm having difficulty in breathing.
Let me check your arterial oxygen. It's a little bit lower than normal. Don't worry, I've already ordered oxygen for you because the nurse already told me earlier that you're having difficulty in breathing. The oxygen should be here any minute soon.
Thank you, doctor.
Aside from difficulty in breathing, what are the things that are bothering you right now?
I'm also having chest pain.
I see. So is it manageable?
No, doctor.
Could you tell me exactly where the pain is?
It's on my right chest.
Can you still remember when it started?
It started 4 hours ago.
Did it start all of a sudden or gradually?
It was very sudden.
What were you doing when the pain started?
I was reading a newspaper during breakfast 4 hours ago.
Did you experience any trauma recently?
No, doctor.
Is the pain consistent or intermittent?
It's on and off, doctor.
But are you feeling better now or worse?
I feel worse each time I take a deep breath.
What is the pain like? Is it sharp? Dull? Pressure-like? Or is it similar to indigestion?
It's a pressure-like pain.
Is there anything else that makes the pain worse? Like cough or positional changes?
It becomes worse each time I move or take a deep breath.
But is there anything that makes the pain better?
Yes, doctor. I feel a little better each time I take anticoagulants.
Do you have any other symptoms like shortness of breath, cough, dizziness, fever, chills, runny nose, sweating, nausea, vomiting, diarrhea, constipation?
My heart beats faster than usual. I feel dizzy at times together with low blood pressure. My temperature goes up and I sometimes catch my breath.
Don't you feel any weird heartbeats?
No, but my heart beats fast.
Do you have any other illness like cancer, stroke, blood clot, or what we call deep vein thrombosis?
Luckily, I don't have any of those.
What about past illness?
No, doctor.
Have you had any surgeries recently?
No, doctor.
Are you taking any medications right now?
Yes, doctor.
Do you have any food or drug allergies?
No, doctor.
Is there anybody in your family who is experiencing the same symptom?
Yes, doctor.
Is there anybody in your family having problems in the lungs?
No, doctor.
Anybody had a cancer in the past?
My father has lung cancer.
Is there anything that I missed out? Nothing else that you think I should know?
No. I think that's all.
Now, I'd like to examine you a little bit. Is it okay with you?
No problem.
Okay, Mr. Jones. According to my assessment, the most likely source of your symptoms is the so-called pulmonary embolism. It is a little clot blocking your blood vessels going to the lungs. A part of your lungs collapsed, which resulted to the symptoms that you are showing right now. but we are not certain yet if it is really pulmonary embolism. Other possible disorders are pneumonia and pneumothorax. The lungs are covered with 2 layers of membranes, but there is not space between these layers. Once the air gets in between the layers for some reasons, chest pain happens, and that is what you are experiencing right now, which is what we call pneumothorax. It is less likely to happen, but there are still chances that heart problem could be the cause, like myocardial infarction. To get an accurate diagnosis, I'd like to run some tests such as ECG, chest X-ray, and some blood tests. You might also need some more complicated tests later on. Do you have any questions?
Can you at least ease my pain right now? Can you give me some painkillers?
I know that you are under a lot of pain right now. However, giving you any medication will alter your symptoms and it will interfere with the evaluation. It will only take a few minutes. I am trying to give you the best treatment possible. And I promise to give you medication after I am done. So please bear with me. I won't take long. Any other questions?
No.
As soon as I get the results, I'll let you know.
Nice to see you today, James.
Hi, Dr. Klein. Nice to see you, too.
I'm glad to see you are staying on track with your checkups and cleanings every 6 months.
Yes, I know how important it is to come in here regularly. When I was younger, I used to skip checkups, and I had a lot of cavities and gum problems as a result. I can't get away with that now.
That's for sure. I'm glad that now you are nipping those problems in the bud. Let's see. When was the last time you had a set of X-rays done?
I think you took some X-rays during my last visit.
I'm checking your chart right now. Yes, you are absolutely right. Since you had X-rays done last time, we won't need to take any today. We only need to take X-rays once a year. So if you'll just open up nice and wide, we will start the cleaning.
How do my teeth look in general? Any problems?
Well, you have got a lot of plaque on the upper teeth. Also, it seems like your gums are bleeding a lot. Have you been flossing regularly?
I think so. I floss every night.
You might want to try a special electric toothbrush. That would help you reach difficult areas of your mouth more easily. You can find them pretty cheap at the pharmacy. They have come down in price. You can rinse your mouth with a little mouthwash now.
You know, Dr. Klein, I notice that I have a sharp pain in my teeth when I drink something cold or eat grapes from the refrigerator.
I'm not surprised to hear that, James. Your gums are receding, so your teeth are becoming more sensitive. Cold food and beverages will tend to be a little uncomfortable.
Is that something I have to live with for the rest of my life?
Unfortunately, yes. But there is a special toothpaste that we recommend, which can help to reduce that pain. I have some free samples I can give you today, and when those run out, you can buy the toothpaste at any pharmacy.
Is it sold over the counter?
Yes, it is. You don't need a prescription. It's just a little more expensive than regular toothpaste.
Do you see any cavities, doctor?
No, I don't. I'm happy about that. The only thing I do see is that this one filling looks very old and weak. We should keep an eye on it.
Why is that a problem, Dr. Klein?
Well, we want to make sure that the filling doesn't break apart. That would potentially expose the cavity again, which could lead to more serious problems.
If I notice anything unusual, I will be sure to let you know.
Other than the things I mentioned, I think you are doing fine. We are just about done. Remember, please, brush twice a day and floss every night.
Thanks, Dr. Klein. You really made my day when you told me that I don't have any cavities. There is nothing that makes me more nervous than that drill.
You won't have to worry about that for a while, James. You take care now. Don't forget to pick up your samples of toothpaste from Marcy on your way out. She will also set up your next appointment.
Okay, Dr. Klein. Bye. See you in 6 months.
Good morning. How can I help you?
My grandson has fever.
What's his name?
His name is Dylan.
Oh, you must be worried. I'm sorry. How old is Dylan?
He's 2 years and 2 months old.
Did you measure his temperature at home?
Yes, I did.
When did the fever start?
About 5 days ago.
So, is the fever there all the time? Or on and off?
It's there all the time.
So you think it's getting worse?
Yes, I think it does.
How is he doing? Cries a lot? Or quiet and weak?
He is very irritable, refuses to eat and drink.
Is there anything that makes it worse?
Yes, it becomes worse every time he cries a lot.
Is there anything that makes it better? Any medications?
Drinking a lot of fluids make it better. We used fever reducer drug like Tylenol.
Does he have any other symptoms? Chills? Cough? Runny nose? Any difficulty swallowing? Shortness of breath?
He has cough and runny nose.
Does he have any phlegm too?
No, I have not noticed any.
Have you noticed him pulling his ears? Any ear discharges?
Yes, I noticed him doing that, and he has some whitish discharges.
What about rashes? Seizures? Or eye problem?
No.
Any changes on his urination?
None at all.
Any vomiting? Diarrhea? Or changes on stools?
He experienced vomiting and also diarrhea.
Does he eat well? What does he eat?
His appetite is low. He only eats clear soups and flavored gelatin.
Does he have any problem sleeping?
At this time, yes.
Has he ever had similar episodes before?
No.
Any illness before?
None at all.
Does he have any allergy?
Yes, on peanuts.
Is he taking any medication other than Tylenol?
No, only Tylenol.
Does he have any other medical problems? Any hospitalizations?
He had an ear infection.
When did he have an ear infection? Was he treated?
Last month, doctor. Yes, he was treated with antibiotics.
Any surgeries before?
No.
Now I would like to ask you some personal questions which can be very helpful to figure this out. Is this okay with you?
Sure, it's okay.
Is there anybody around him being sick now? Or recently?
I heard that there are some sick kids at the daycare center.
So he spent most of the time at the daycare center? And then home after that?
Yes, that's right.
What do his parents do for a living?
His father is a businessman and his mother is a teacher.
Have you traveled with him recently? When was his last time out of Los Angeles?
No, not yet.
Has he been exposed to any animals, including pets?
No.
Does anyone in your family smoke?
Yes, his father smokes.
Was he a full-term baby?
Yes, he was.
Any complications during pregnancy or after birth?
No.
Are his immunizations up to date?
Yes.
Does he have well baby checkups? When was the last time? How was the result then?
Yes, that was last month. The released result was about his ear infection.
Does he have problems on development? Height, weight, language?
I think he does not have any problems on development.
Have you recently moved?
No.
Thank you for answering all these questions. Is there anything that I miss out here? Or anything you think I would better know?
It's okay, nothing at all.
Mrs. Scott, thank you for the information you have provided. It sounds like Dylan has some sort of upper respiratory tract infections. But it's hard to say it for sure now. I need to examine him and run some tests to evaluate his symptoms. So I would recommend you to bring him over here as soon as possible. Babies have weaker and more sensitive body than we adults do. So I would like to see him closely. Do you have any questions?
None, doctor.
Okay. It was very nice talking with you. I hope this helps, and I am looking forward to seeing you once you come in with your grandson. Okay? Okay. Thank you, doctor. Good morning. How can I help you?
My daughter is a picky eater. I wonder if you could give me some advice on what I should do.
Okay, Mrs. Smith, I would like to ask some questions about your daughter. What's her name?
Her name is Kyla.
How old is she?
She just turned 3.
Why do you think she is a picky eater? Does she have any specific preference for food?
Yes, she only eats some potato chips, candies and fruits. She does not like to eat regular meals.
Does she often drink high-calorie drinks like juice, soda, or milk?
She only drinks milk and water.
When do you think she started behaving like this?
2 or 3 months ago.
She does that all the time?
Yes.
So you think it's getting worse?
Yes, I think it does.
Have you ever punished, bribed, or rewarded your daughter to alter her eating behavior?
No, doctor.
Do you usually follow a set schedule for meals?
Yes.
Do you usually give her any desserts with regular meals?
Sometimes.
Does she watch TV before mealtime?
Yes, she watches TV sometimes.
What kind of diet does she take? How many times does she eat in a day?
I began to include small pieces of fruits and meat in her diet. She eats 5 to 6 times a day.
Is there any reason you can think of why she is not willing to eat meat?
I am sorry, but I have no idea.
Did she have any experience of vomiting or diarrhea after eating meat in the past?
No, not at all.
Does she hate the smell or taste of meat?
Oh, I am not really sure about that.
How would you characterize your family's diet?
We eat meat and vegetables.
Does she have any symptoms like constipation? Belly pain? Bloating?
She has constipation.
How many times in a week does she have bowel movements?
2 to 3 times a week.
What is the stool like? Hard? Large? Dry? Painful to pass it?
It looks dry and hard.
May I know the color?
Light yellow.
Any blood in it?
No, I have not noticed any blood in it.
Have you ever noticed any bright red blood on the toilet paper?
I have not.
Does she usually sit on the toilet long? How long?
Not too long, probably just about 3 to 5 minutes.
Does she hold defecation when she plays?
No, she does not. I can say that because she feels uneasy and informs right away that she wants to go to the bathroom.
Does she resist toilet training?
Yes, sometimes.
Any urinary problems?
Not at all.
Any other symptoms? fever, headache, cough, shortness of breath?
No.
Did she ever have similar episodes before?
No.
Did she ever have health problems?
No.
Any hospitalizations?
No.
Any surgical operations?
No.
What about allergies?
She has no known allergies.
How many children do you have?
She is the only one.
Do you have any complications during your pregnancy or delivery?
No.
Was she healthy after the delivery?
Yes, she was.
Being her parent, how often do you spend time with her?
A few hours a day because we both have work.
Who takes care of her then?
She goes to the daycare.
What kind of house do you live?
Very old one.
Are her immunizations up to date?
Yes.
When was her last well-child checkup?
6 months ago, and everything went well that time.
Did she have any infections before?
No.
Did you just move here recently?
Yes, we just moved here 6 months ago. So is my daughter okay?
Based on what I have heard from you, I think that your daughter's not eating well as part of normal behavior of toddlers. It's pretty common in that age group. But even though the chances are low, there are some other possibilities of behavioral changes and constipation. So, I will run some tests to rule them out. Does this sound okay to you?
Yes, that sounds good.
For her eating problems, I would like to give you some hints to make it better. It can be helpful for you to follow a set of eating time. With this, she can naturally realize the mealtime and get ready. Also, it's better to cut down high-calorie drinks or snacks between meals. One more thing, eating environment is important sometimes. So it's better to block her from any possible distractions like TV. And for constipation, I would like to suggest that you give her high-fiber diet like cereals, fruits, and vegetables.
Yes, that sounds good.
So I would like you to take your daughter here soon.
Sure.
It was nice talking with you. Have a good day.
In today's video, we have compiled simple and relatable conversations that you might encounter in your daily life. These conversations are not only a great way to improve your English, but also to understand how English is spoken in real-life situations. So, whether you're a beginner or looking to brush up on your English skills, you're in the right place. Let's dive into these everyday English conversations and make learning fun. Please like, share, subscribe and hit the bell icon to get notifications of our new videos, and also comment.